You brush, stroke, downstroke, and then jiggle. 3 counts. 1, 2, 3, and then push out. Now may jiggle tayo. Jiggle. Mabuhay to all the likers and subscribers. If you are a new viewer, I'm Dr. Lillian Lasaten Ebuen. You can call me Dr. Lillian, Dr. Lian, Dr. Ebuen, or simply Lillian. Here in this episode, we are going to talk about proper toothbrushing. Laki ng toothbrush ko. Well, this is not a toothbrush that we're going to use. Actually, panchika ko to sa mga bata na pasyente ko. Yeah, so together with this, to inspire them. I'm not a pediatric dentist, but there are a lot of kids who also come here to get their treatment done. Anyway, so going back to the brushing technique, let me just introduce first about toothbrushes. Doc, ano ba talaga yung magandang toothbrush? Ganito ba? They mention a lot of brands. They do.
But ito kasi ganito, ito, ganyan, solo.
Maraming klase ng toothbrush. But in choosing the proper toothbrush for you or for each individual is different. There are a lot of different toothbrushes that we can use. Whatever is appropriate for our oral health need is what we use. Siyempre, maraming klase ng toothbrush. Merong cheap na toothbrush, merong expensive na toothbrush. So, ano ba talaga? So, sometimes, Doc, bilhin ko kaya yung pinakamahal na toothbrush. O, di ba? Parang, bakit? Pagkamahal ba yung toothbrush, ibig sabihin, sobrang effective na siya? So, ito na nga, maraming klase ng toothbrush. So, which one is really appropriate for us? Ito, you see this, hard bristles. So, as I run as you run yung finger on the tip of the bristles, matigas, di ba? Pang pustiso po ito. So, use this for pustiso, denture toothbrush. Yan, yung mga klase ng matitigas. Next, yung isang toothbrush naman, actually, this is a very cheap toothbrush, no? Yung bristles niya, ang daming bristles, punong-puno ng bristles. This is also good. Tapos, when you run your finger over the bristles, yung tip ng bristles, medyo malambot na siya. Alin dito talaga yung pipiliin namin, Doc, na toothbrush? So, maraming klase, iba-iba. For patients who have bleeding gums, who have gum disease or gum problem, you need soft bristle toothbrush. Pero if you notice also, meron yung mga toothbrush din na may mga nano bristles, nano-size tip ng bristles. This tip naman can also reach deep inside in between your teeth. Yan. So, like for example, dito, no? So, ayun, no? Kita nyo yung nano-size na bristles. It can reach inside, in between your teeth, ganyan. So, maganda siya. Meron naman yung isa, meron siyang palubog dito sa gitna, no? There's a concavity here. So, that concavity is a space for your braces. So, mga tao na naka-braces, yan, kung naka-braces tayo, no? So, papansinin niyo yung concavity, yung depression dito sa gitna, may space yon para yung longer bristles doon on the outside can reach doon sa tooth surface. At the same time, yung nasa gitna, yung concavity na yun, nabobrush niya yung mga brackets, yung mga braces. Itong mga type ng orthodontic toothbrush na to, this is really nice, no? It's really good kasi meron siyang interdental toothbrush. Also, another one is, yan, regular toothbrush din na manipis. Kasi there are patients or there are people here na yung cheekbone nandun na. So, mahirap ipasok yung toothbrush, di ba? So, tumatama na doon. Kaya, minsan, we see patients na bandang second or third molar nila, yung mga last molar, back teeth nila, hindi masyadong nalilinis and then puro cavity. Kasi ang complaint nila, kasi it's hard to reach, doc, I cannot really clean it well. So, yun. Okay. So, my advice for those type of patients na mahirap, hard to reach yung area, this is a slim toothbrush. So, pwede yung ipasok in between and do some strokes. So, sometimes I also advise my patients to get a baby toothbrush. So, kasi mga baby toothbrush, di ba, maliliit siya. So, you can reach far back dun sa end ng teeth ninyo. And also, there are these tiny bristled interdental toothbrushes. Maraming klase nito sa market, no? And para saan ba ito? So, ginagamit siya to brush in between your teeth. So, when you brush, kasi syempre, depende rin sa size or sa size ng gap. Kasi may mga patient, no? So, parang expose yung ano nila, may gap in between, di ba? So, you can use this interdental toothbrush. So, ay! Nahulog yung ngipin. Going back to the technique. Ito na yung technique, no? Actually, there are different types of methods of brushing. Yun yung merong Stillman, merong Bass method, merong Charter's brushing method, merong circular brushing. So, maraming tawag doon. Pero wag na natin i-memorize yan kasi I'm here to teach you how to really do it in actual way. We will use here the soft bristle toothbrush. So, there are a lot of different techniques. So, meron doon yung sinasabi na, you brush, pag gano'n, no? Pag gano'n, up and down, circular, ganyan, no? Very confusing yon kasi saan dito? So, parang walang direction. Kailangan may direction. So, for me, when I teach my patient how to brush their teeth, merong route. In brushing, I also want technique. Technique and proper routing. May proper routing pala yung toothbrushing. Hindi parang,
Nag-toothbrush ka dito, o doon na naman, tapos dito, tapos doon sa taas, ganyan.
tapos, 1 minute lang or 30 seconds lang, you're done. No. Please, when you brush your teeth, you have to brush your teeth at least 3 times a day. Kung wala na tayong time at sobrang busy tayo, no? Please, spend time brushing 2 times a day. Kung sobrang nag-aapura tayo sa umaga, dahil yung malilate na tayo sa trabaho o malilate na tayo sa school, so we only have 1 minute to brush, o sige, pwede na yan. Pero please, pag gabi naman, when you brush your teeth, mag-toothbrush tayo at least 3 to 5 minutes. How we do it? Of course, for example, ito na po yung bibig natin, no? You open your mouth. You have to open your mouth para makapag-brush tayo. Okay. You can start either way. You start on the left or the right. Okay lang yan. Kung saan ka komportable. But when you start on the left, you go to the right. You start up here, going downward. So, yung strokes ng toothbrush, ng bristles ng toothbrush mo, brush downward stroke. Yeah, downward stroke. Yung downward stroke, pansinin nyo rin yung nano bristles. Ang ganda nito, yung nano bristles. It goes in between your teeth. So, nalilinis na rin niya hanggang loob. Of course, you have to press down a bit. Now, paano? When you brush and push inside, you jiggle your bristles in between your teeth. Yan. You brush, stroke, down stroke, and then jiggle. 3 counts. 1, 2, 3, and then push out. Now, may jiggle tayo. Jiggle. Not only 1 time. You have to do it 10 to 20 strokes. 1, jiggle, out. 2, jiggle, out. And notice also yung movement ng toothbrush. Practice makes perfect talaga. At first, it could be difficult to, just do this. Hindi pwedeng ganyan. Hindi pwedeng, no. Look at my hand. Pag ganon, no. You twist your toothbrush. Pag ganon. Twist. Twisting motion. So, you have to practice with your finger, your thumb. Yan, no? So, pag nasa right side na, no? Where do you go next? Punta ka sa likod. Sa likod naman. So, again, you do the same thing. Strokes, outwards motion. And look at the movement of my fingers, no? 10 to 20 counts also from the inside. And don't forget to jiggle in between also. Of course, pagka front teeth na, yung strokes should be paganyan. Yan. Yun. Okay? Sa front. Pero pagdating ulit sa back teeth, go around ulit. Twist again your bristles. yung toothbrush twist. Okay, so fine. Tapos na yung upper outside, from left to right, inside upper right, to the left. Tapos na. What's next? Upper top. Yung upper top will be itong, so when you reach this part, here, ang stroke should be pwedeng forward, backward motion, or you can do circular motion. And then what's next? Oh, tapos na tayo sa upper. Then we move on the lower. If we end on the upper right, when we go down, lower right naman. Sa lower right, ano yung strokes ng toothbrush? Yung strokes ng toothbrush should be upwards stroke na. So, kung upper is downward stroke, kung lower teeth naman, upward stroke. You have to take a lot of patience and really take your time in brushing your teeth at night because this is very important. Can you imagine? We will be sleeping 6 to 8 hours over the night, and just imagine the formation of bacteria inside your mouth if we don't clean it properly. By the time you wake up, yun na nga yun pagising natin, may amoy. Same thing, 10 to 20 counts and jiggling in between. Okay, you jiggle your bristles. Ganun pa rin, no? Yon. So, ganun. Don't forget. Continue. Upwards stroke, no? So, from right naman, going to the left. And then, what's next? Go to the back. Left, back. And strokes of your toothbrush, outwards then, no? See, ganyan. 10 to 20 counts. And don't forget, again, continue to jiggle in between, no? In between. And then, syempre, ito pinakamadaling stroke talaga yung bristles ng toothbrush when you pull your toothbrush outside stroke like this. Wag pa ganon. Wag inwards. It should be outwards. Why? Because if you do that strokes na inward motion, you are going to push your gums downwards. Pag bumaba na yung gums, kasi nga ang strokes ng brushing natin, pa-push sa loob, this is what's going to happen. Parang, hala, Doc, yung ngipin ko umaba. Diba? Parang umaba. Kasi nga pinush mo yung gums downwards. Top portion also, we have to scrub in and out, in and out, or you can do circular motion. See? Oh, circular motion. And what's next? After brushing your teeth, well, of course, you need to gargle with a mouth rinse. Pwede namang, Doc, mahal pa yung mouth rinse Pwede ba, ano ba yung most economical mouth rinse that I can use? O di salt water na lang. So, okay, after brushing your teeth, you need to clean your tongue. So, filiform, we call it filiform. So, eto siya. For example, this is your tongue. You have to, well, what we do, what I can recommend, especially for patients who have like, yung tongue na parang namumuti na, yung parang nagmumukhang carpet na. You can massage your toothpaste dyan. Massage yung toothpaste, no? And then you can, yung scraper mo, you can really press down. Yan. Press down, i-massage ninyo yung tongue. And then next, you scrape it out, palabas. Okay, scrape it out, palabas. And then of course, you gargle. Okay, fine. Kung wala kang tongue scraper, if you have a hard bristled toothbrush, like a regular toothbrush, not the nano toothbrush, yung nano-sized bristles, you have the regular toothbrush, yun, pwede rin siya pang brush ng tongue. Oh, don't forget, yung gilid ng tongue, yung side, no? Yung side ng tongue, you also need to brush that area. Okay, and then after that, what's next? Of course, we need to floss. Pagka magpo-floss, take this. What I do is, you fold it into two. Yan, fold into two talaga, no? Yan, and you can do this. I'd like to end this vlog with a myth. Sabi nila, charcoal toothpaste is better. Is it true or false? False! It actually absorbs the protective agents that helps protect our teeth in making our teeth strong. There are many toothpastes available in the market. Use any brand you like. But for me, with my advocacy, I push for no fluoride toothpaste. Fluoride is toxic. Please don't forget to comment below if you want to ask questions, or there are topics that you want me to discuss. Please don't forget to comment below. And thank you all for watching. Please like and subscribe.